Hi, I'd like to talk to you about how you manage overtime as a junior doctor. This is a pretty common but sometimes contentious topic. So let's jump in, and as I say to most of my videos, this is just my views, and I would recommend that you ask other people their opinions before you decide how you'd like to approach overtime in your organisation. So there are 4 principles that I'd like to convey in terms of managing overtime as a junior doctor. The first one is leaving on time, because if you leave on time, there is no overtime issue to manage. Setting your boundaries in terms of how much overtime that you're willing to give, whether it be paid or unpaid. Using the overtime that you do use very effectively and in a focused way, and then how to actually claim your overtime. So we don't ever set out to do overtime or stay late, but there are a lot of barriers that keep us in the hospital with good reason. Sometimes it's beneficence towards the patients because we genuinely care about their well-being and we want to give them the best that we can as aspiring practitioners. Sometimes it's because we have a very negative attitude towards incomplete work, or we perceive that others may have that attitude and we don't like to leave things undone. Sure enough, so many of us are type A personalities within medicine and the health professions, and so it's not surprising that we like to leave everything done and tick all the boxes before we walk out the door. Also, there can be some perceived shame, or a bit of a culture of shame, of handing over jobs to people that are on cover shifts or on nights. And I think it's really important that we actively work against those kind of attitudes, because they're not helping patients and they're not helping each other as colleagues. There can also be concern for unstable patients. So if someone is actively deteriorating and you're meant to be finishing, of course the beneficence and the continuity of care for that patient will often mandate that you as the primary carer stay behind, and those are the situations that most people don't argue that should be a paid overtime event. Then there can be pressure from seniors. There's a lot of managers and heads of unit that are working with tight budgets, and the last thing they want is junior doctors claiming lots of overtime that are going to make them go over budget. So it's really important that you negotiate and work out what are the right processes within the unit that you're working on that are going to allow you to make use of overtime in an appropriate way that's agreeable to all parties. I think there's something that we always need to keep in mind, is that our health system is not a charity. Our health system is a business that's owned by the government. It employs people, and it works to budgets and it works to specific outcomes. If the system is not working, sometimes you need to let the system show that it's not working in order for it to be fixed in the long term. And in the short term, just making sure patients are safe and they're receiving good quality care. As a junior doctor, be very careful about how much time that you're willing to give, particularly in an unpaid capacity, because the system will take as much as you're willing to give it, and that can often lead to burnout at an early time. So be aware of that. So the first principle is about leaving on time. And leaving on time can often be a challenge, and the number of tasks that you'll have for your inpatients will usually exceed the allocated time that you have on a shift. So it's important first to accept that there will be things left undone, and then think strategically about what are the things that do need to be done during the time that you're on. What are the jobs that are specific to your role, or perhaps your relationship to the patient or their relatives. Some jobs can be left undone, and they're the things that can be handed over to the next day or done yourself the next day. Things that are non-urgent, perhaps discharge summaries, they should be ideally done within a day or two of discharge, ideally on the day, but those things are not going to be critical. Some things, like chasing up results or putting in a new cannula, are things that could wait until like the afternoon or the evening in terms of time-wise, and are very appropriate to hand over to a colleague to do in your stead. Things like documenting ward round notes or family meetings or conversations that you've had or major decisions from the day, they're things that really need to be done by you, and so prioritising your time to focus on those tasks specific to you is a way to make sure that can be done well. I think with your time management, a lot of people are doing roles where it's like an 8 till 5, and actually planning your time management to say, I'm going to leave, try to finish up around 4:30, will leave time for unplanned tasks that arise. Also time just to finish up at the end of the day and do things that maybe you've forgotten or just need to tidy up, whether it be the blood forms for the next day or updating your handover sheet, or just handing over to your colleagues, or even debriefing for the day. So planning to leave half an hour at the end of the day for those kind of things is a really wise idea. It's really important to ask for help whenever needed. We're lucky that a lot of roles you have other intern colleagues, or at least you'll have other residents or registrars. So when you're feeling under the pump and there's a lot of tasks, it's really important to actually say, I've got a lot on my plate, is anyone able to help? There's no shame in asking for help. In fact, it's a very wise thing to do and will speak well of your time management, showing that you know these things need to be done. You're putting the patients first by asking your colleagues for help. Equally, if things are quite quiet, it's really good to let your colleagues know and say, look, I'm pretty quiet, does anyone need a hand? And having that culture of being able to ask for help, but also volunteering when you're free to help out as an extra is a really good thing to do, ideally within the unit and sometimes between units that are working closely together too. If it's non-essential work, like we said, we can leave that till the next day, and otherwise you can hand over generic jobs on time. And all of these things, if done well, can contribute to, on a daily basis, you leaving and walking out the door on time, and that's what can be reflected in your timesheet as well. It's really important on the other side for the people, whether it's you or your colleagues who are doing the afternoon cover, the evening cover, weekends or nights. Part of your first role of your shift is to ensure that you're getting your colleagues who are just finishing out on time. And I think that's a really good principle where often we have a half an hour handover period. Is the first thing is to call up those colleagues and say, hey, I'm here, do you want to come and hand over tasks so that you can get out on time? Let me know what it is. You just give me all your jobs, because essentially you're paid to be there as the cover person and the rest of them are not. And so that's the best thing that you can do. Even if there's lots of tasks, even if it's going to take some time to do those things, that's how the system's set up. And so the best thing to do is to follow and use the system how it's designed to work. Next thing that I want to talk about is setting your boundary. Inevitably, all of us will give some time to overtime, whether it be unpaid or whether it be paid. And before you get to that point, and this is ideally as a senior student or maybe an incoming intern, it's important to consider, what am I willing to give in terms of free time to my workplace? What am I willing to give in terms of paid overtime? And a lot of this is going to be a very individual thing based on your lifestyle, about your own needs, about the needs of the important people in your life. If you have a family, if you have a partner, those needs are going to factor in. And having a limit is really important. And on occasions, being able to communicate and say, well, I'm meeting someone at a certain time after work, I need to make sure that I finish on time today, but maybe another day I'm willing to stay back a little bit extra to help out the team. It's important to communicate within your team. For myself, my limit is definitely 30 minutes. So I'm happy to put in up to 30 minutes a day of free overtime for the benefit of patients. But if it's more than 30 minutes, I'll always claim that overtime, because I feel that my work is valuable, and you should feel that your work is valued too. And as an organisation, we should be paying you your overtime because we're valuing the work that you're doing and the care that you're providing to our patients. Let's say you are going to do some overtime, whether it's paid or not. It's really important that you make sure that that time is very structured and very focused on specific tasks. So the first job, when you finish, is to turn off your pager, because many well-meaning colleagues, nurses and others won't realise what your finish time is and will page you. And if you don't respond to that page because you've turned it off, they will just page the right person. They'll think, oh, this person hasn't responded. They must have finished. I'll call the cover person, which is the person who is paid to respond to their queries. Likewise, if someone, a well-meaning colleague, comes and finds you on the ward as you're writing up a certain note before you leave, or making sure there's the discharge prescriptions for the next day planned because you wanted to stay back half an hour to do that, they come and find you and say, hey, do you mind reviewing this patient for hypotension? You're probably going to say, I would really love to help, but I've actually already finished and I'm just trying to tidy up these things before I go. Why don't you call X intern who's on cover? I'm sure they can come and review. And if it's urgent, why don't you call a Met call? These are the kind of things that most colleagues will respond well to. Certainly for myself, if they're just saying, hey, do you mind just ordering another set of fluids? You might say, no worries, that's just going to take you 2 minutes, happy to help. But if it's any more complex tasks, better to defer that to the person that's actually paid to be there. Have those specific goals, and then when you've done your goals, get out of there, because you're done. The last thing is to claim your overtime. It's really important whenever unit you work on, and as junior doctors we move between a lot of different units, whether it be surgical or medical or emergency or psychiatry. Each of them has a different approach to the working hours that they've set. Each of them has a different policy and process for claiming and approving overtime. So it's really important to talk to maybe your outgoing colleagues that you're taking over from, to ask what's their experience of overtime, what's the kind of culture that may be unspoken that's there, and then to ask your supervisors to say, what's the approach to overtime here? Is overtime supported? Under what circumstances? And what's the process for me to do the right thing when I am attempting to claim overtime? If it's very specific from your senior management that they don't want to have any overtime, then I would encourage you to not work any overtime. Use the system that they've established, hand over to colleagues even when it's busy, and when it's busy and you're the person taking over in the latter part of the day or the night, be the intern that says, don't worry, give me all your jobs and go home, we'll manage it as a team. Now lastly, I think it's really important to bust some myths about overtime. There is no department that I am aware of, speaking to senior and junior staff, that have a blacklist of interns or junior doctors who have claimed overtime, who are going to get bad assessments or not going to get offered jobs. If there was such a department, I would advise you never work for that department, because that kind of practice is quite unethical. So none of those things exist to my knowledge, and I wouldn't go into it with a fear that you are going to be put on some kind of blacklist as some kind of greedy intern for asking what the process for overtime is. It doesn't exist. The other thing is that claiming overtime should not affect the quality of your references or your referees. They're always asking the question of, what is this person like in terms of the quality of care they provide, the efficiency, their clinical skills, their reasoning. They're not asking about, does this person claim overtime? In fact, good time management, which includes the management of overtime, is a mark of a good doctor in training. So I would encourage you to think carefully about your overtime and manage it wisely. So let's summarise some of the things we've talked about during this session. There's 4 principles we've talked about: leaving on time and identifying the barriers that are going to keep you in the hospital, setting your boundaries in advance on how much unpaid and paid overtime you're willing to offer to your unit and your patients. When you do overtime, use it in a very focused and effective way, turning off your pager and deferring other new queries to the colleagues that are on cover, and then claiming your overtime in the right way that's supported by your department. My top tips would be, don't treat your hospital like a charity. It's a business, it's there to care for patients, and you should feel valued by the organisation that you're working for, which means that they pay you what you're due. Hand over on time, help your colleagues leave on time. I think it's so important to support that kind of culture and recognise the value of your time and claim it where possible. Thanks for listening.